And you're just going to feel this touch your cheeks. I'm going to take several different areas. And we can see we have 3 readings. I'm going to push the button. You'll hear bada bing. And here's her melanin index, which came up to 14, which is quite low. She's not tanned even though we're in summer. So I'm going to accept that reading. And with a melanin index of 14 at a pulse width of 20 milliseconds, I can actually go 42 to 44 joules, which is a little more than we have. And we're going to go a little more conservative. So we're set to go. Let's get our eye protection on the patient. And everybody will put their pulse light glasses on. Okay. So there's nice cooling in this tip. You're going to feel the cooling and you'll feel 1 pulse. And you're going to just see a train of pulses coming down. If you need to break it all, you let me know. So Laura, the Max G is a phenomenal device. It's actually not a laser. It's an intense pulse light, but with a very specific spectrum that is made to absorb blood vessels, and it also gets pigmentation. So every laser or device hits a target, and this one goes after vessels and pigmentation. In your case, you have more pigmentation. And we'll just get a look, and the skin looks perfect. So we like to see a nice little skin response. So here we're just going to continue with the Max G treatment, which has a spectral filter that's very unique and different than many other technologies. The wavelengths coming out of here are 500 to 670. That's quite specific for superficial blood vessels, and it gets nice pigmentation. Everybody has a little bit of something that's color on their skin that they're not happy with, either a little bit of brown or a little bit of red. And that's from a little bit too much sun about 20 years earlier. Now there's nice cooling in this tip, and this is the most expensive and safe kind of cooling that you can have. Under the tip here we have a nice sapphire crystal, and this crystal is maintained at a temperature of 5 degrees centigrade. There's a feedback loop to the laser and the Icon device where if it's not 5 degrees centigrade, we won't fire. So as we're treating, I actually see a nice tissue reaction, and this is what we want to see. We want to see that the patient is developing some confluent erythema around the targets. Those targets are called chromophores, and the chromophore for the Max G, of course, is pigment and blood vessels. So I like to cover the whole field, 1 to 2 passes until we get our clinical endpoint. And the forehead can be a little bit more uncomfortable. So my general technique is to start with the lateral face, come across the nose, go to the other lateral cheek, hit the chin and the upper lip if needed, and I finish up on the forehead.